I was asked to introduce myself. I'm Tom McLellan. I'm from Philadelphia. Our host had a serious problem, something to do with a 60-year-old bladder. So, I wanted to, Mark, I'm going to give you some unsolicited advice. Don't waste money on a white suit. You're not going to make it as a televangelist. But I'm going to follow right along. I'm going to say many of the same things. So it really is in the spirit of everything's been said, but not everybody has said it. I am going to talk a little bit from a different perspective, but basically the same message this morning. This is a very old slide, 1989, Institute of Medicine. And it's going to say pretty much what Mark's just said. And we've heard it over and over and over. But just to preface my comments, I'm not going to give you a clinical talk. I've been working now with the Wharton School, and they're a business school. And I've really become very interested in research and business. And I think recovery is a tremendous business opportunity. I think it's going to be a real hot seller in the community for the same reasons that Mark did. Let's look who we're talking about here. Mark showed it going this way, I'm showing it going this way. But down here is most of the population. Most don't drink at all or drink very little, don't use at all substances or use very infrequently. Okay? In here is a group called harmful users. We don't know how many of them there are. We know a little bit about alcohol, but we don't know how many of the harmful users are. We don't know what the full nature of that harm is. Mark talked about that. We know that people do exhibit the symptoms of a disease that we provide treatment for. And right up there at the top is around the 10% we've been talking about that are actively in treatment. For decades, I have understood this pyramid very clearly, very easily. These people here are the treatment eligible, and they're all in denial. These people are the only ones that have come to the realization that they need treatment and are willing to get it. What we need, I said, as I looked at this with clinical eyes, are drug courts. We need more outraged wives. We need more outraged husbands. We need employers forcing people into treatment so that they can come to that understanding. Okay, and actually I still believe some of that, okay? I show the same graph, pyramid, to the business guys, and they go, oh my God, what a business you got here. Look at all this potential demand. But of course, you don't have products that they appear to want. Oh, boy, that stings. That really stings. But it is one plausible interpretation of this. Now, faced with this kind of problem, let's say at General Motors, don't look for the legislature in the United States to develop Chevrolet courts, where you are forced into the Chevrolet showroom by a judge. It's likely not to happen. What General Motors does is they make different products. They make different products and they try to meet the public's demand. It's in this spirit that I have heard an awfully informative set of discussions today. And I think recovery is a product we can sell. I think there's another important part of this, I think. And that is, I want to make something extremely clear. If I can just make it go forward. Oh, maybe I go this way. Huh? I'm an expert in addiction treatment. I've seen thousands of patients. I've done thousands of ASIs. I've been to all kinds of PERS. I am an expert. Okay? But here's the problem. I'm an expert. It's exactly what Mark was just talking about. I've seen these guys, the guys that are up there. They are in no way representative of these guys. The people who have seen these guys are people in recovery. among the people that have seen, they've seen a broader range of affected individuals, let's say, than most of the treatment providers have. They don't meet lots of it. Of course, some of these guys also are part of the recovery community, but not all. And it's very important because what we know about that population, there may not, indeed probably does not apply to the business of attracting earlier onset, lower severity, more episodic, but still problematic individuals with alcohol and drug use problems. Now, recovery might. Think about the fitness movement. Think about health clubs. Imagine them saying, please come to my health club. I will make you sweat more than anyone. I will make your muscles hurt more than any other health club in the United States. They ain't going to do a lot of business. They show lean, hard bodies, sexy bodies that are the product of hard work and sweat and toil. Okay? Frankly, as a business, that's what we have to do. And recovery, as one of the definitions, recovery is a voluntary lifestyle characterized by sobriety, health, and citizenship. Boy, that's the kind of thing you'd expect to hear from political candidates running for office. These are wonderful qualities. There are other definitions there. Peace of mind, pleasures of life that I never knew. These are wonderful things. That's the kind of stuff you can sell. And the reason I say that is that's one of the elements of effective treatment. You must have, it's not just treatment, it's one of the key elements for quality products in business. You must have informed consumers who have choices. If they don't, you cannot, that's one of the essential elements of the quality in the industry, okay? And another thing I thought was very interesting, again, we're all referring to Karen Carpenter-Palumbo. I found it very important for her to say that she has business lines in her state-run facility. I think that's an important perspective. No, I'm not interested in New York making money on this. I'm interested in having a mentality that tries to attract and pull in people that might use their services, putting the emphasis on the provider of the service to do that, not forcing people into something that should be good for them. And the money's there. Think about iPods. Think about those little blue Tiffany boxes. Think about Starbucks, $3.75 for a cup of coffee. What those people have done is they've shown value to a public for something that somebody else has also offered it even cheaper. But they've produced value. People will stand in line at Starbucks. You see Carol McDavid, she's probably had 5 today. They will stand in line at Starbucks to pay $3.75 because Starbucks figured out how to provide something that the customer wants that they will pay for. People will stand in line to buy iPods when they could get another phone. You don't need an iPod, but you'll buy one because it has the features that you want. That's not coincidence. This is not revelation. This is just America, folks. This is how we do business. And I say it's time for the addiction treatment field to get into the recovery field as a way of sustaining and doing business. Now, another thing, more on the anti-evangelical part, the treatment field is failing. It's not doing well as an industry. We have fewer revenues. We have fewer programs. 10 years ago, there were 15,000 treatment programs. 3 years ago, there were 13,000, and now there are 12,000. It's not growing, it's reducing. People who do go to the programs, average in outpatient, 90% of addiction treatment today is outpatient. Average duration of treatment is 2 visits. 2 visits. They don't want it. Okay, that's right. They're in denial, they've got a problem, they've got a disorder, but they're consumers. And they don't like what they're getting. Now, I is not just valuable to the potential patient. I see the concept of recovery as being extremely valuable, adding value to many other industries. Industries like medicine. Mark, again, talked about lots of chronic illnesses. Well, you turn over one of those chronic illnesses and patients that aren't doing well in those chronic illnesses, you're going to see problematic alcohol and other substance use. It costs money. It frustrates doctors when their patients don't take their meds, don't follow their treatment advice, often due to problematic substance use. If we provide the kind of attractive, effective care, recovery, that those patients can easily and affordably get into, will add value to medicine, and our industry will grow. Ditto criminal justice system. We are working now at the request of, in a certain state, at the request of the governor. The governor asked for a private meeting. He wanted to know, is there any possibility? He's got 6,000 never violent offenders in their prison system. He is spending $500 million a year on those individuals. He's being asked to spend $500 million more to create new prisons. He wants to let them out. You know what's preventing him? The treatment system. The criminal justice system and the population at large are not sanguine about the treatment system. They don't provide the service to the criminal justice system that they might. Yes, that's right. They work with the criminal justice system, meaning they get the referrals, but they don't service the criminal justice system. They don't add value. And it doesn't have to be that way. We're going to try to help create, in a selected set of programs, a real collaborative program between the criminal justice system and the treatment system that will provide public health value, care for the affected individuals, and public safety. That's a business deal. That's something this governor's going to invest in. Welfare system. And there's many other sensitive industries, the nuclear energy industry, the transportation industry, all very seriously affected by problematic substance users, and not, this was again Mark's point, not these guys, these guys. There's loads of them out there, and there's a big business out there if we can develop the kinds of products and services that will attract them and add value in the public. Almost done, guys, you're almost done. Finally, I think, or no, next to finally is, I'm so excited about faces and voices of recovery and the recovery movement generally, because in most of my professional life, recovery people have been invisible. The only recovery people that I even had a contact with the people in AA who felt a prohibition about identifying themselves, an understandable one. To the extent that consumers who have achieved recovery come forward, they're not just, they're importantly a source of hope, inspiration for those who are affected. But more than that, they're a market. It shows the public that there's a market for some of this stuff. It shows big pharma there's a market. It shows other service industries that there's a market for them. And they are an informed marketplace. These are the kind of consumers that can demand quality of care. If you're not in a position to do that, if you, for example, if your wife doesn't get good prenatal care, you're going into your boss and you're going to say, what kind of an insurance company are you buying here? My wife couldn't get good prenatal care. Are you going to do that if your wife's not getting good cocaine treatment? You're not going to bang on your lawyer's desk about that, and he's not going to complain, okay? That's, I think, those are the essential ingredients for really effective kinds of care. And there's another one, and I want to bring this up because throughout the course of this really very attractive day and a very enjoyable set of papers and talks, there is the quite typical throughout my professional life, recovery versus treatment undercurrent. I've heard it expressed a lot of different ways. It's a mistake. It's a mistake. People in recovery, not all, but one of your major suppliers is the treatment system. People in treatment, you need the recovery concept, you need the recovery community to make your products and services more attractive, and to build your business, and to finally get down in here and make the kind of money that you really should be making, and make the kind of public impact that you ought to be making. So we're in this together, guys. Do not do the old circle the wagons and shoot inward here. And I want to make the business case for this. What I've just said is the common sense case. Let me make the business case for it. Lots of industries find that the very best thing you can possibly do is have a competitor. Mars candy bars, old traditional business story. I don't remember what kind of candy they make, but let's say they make, well, probably Mars bars, yeah. And if you put Mars bars out there, they found that they sold, I don't know, I'll make up a number, 10,000 Mars bars. You know what? Maybe not everybody wants our Mars bars, they said. Let's put a second kind of candy out there. I don't know, Almond Joy or something. What happened when they put 2 candy bars in the candy stands? Not only did they sell more of the other, they sold 20,000 Mars bars. What happened was the act of providing choice brought the rest of the market into the game. Ask anybody who runs a restaurant in a small town. Best thing that could possibly happen if you're running a Chinese restaurant is to have an Italian restaurant open up right beside you. You're going to get a lot more customers. When they make shopping centers, they won't make shopping centers because they go out of business unless they have 2 anchor stores that are basically competitors. The act of having choice brings more people into the marketplace. It's an essential element of quality, okay? So, with all that said, I want to end with something I've been thinking about as I've been sitting here, especially this very nice segment about research in this field. We owe an awful lot. There's not been an awful lot of research in this area, but the major people who have done that work are in this room, and I refer to George DeLeon, Bill White, and Alexandra Laudet. So I want to thank them. I want to thank you for toughing it out and listening to me, and now we'll have an announcement.